Hi, my name is Brandi Reyna, and I'll be doing an assessment over head, eyes, ears, nose, throat, skin, hair, and nails. So first I will start by inspecting the head and the face. So what I was looking for is symmetry of the skull. There is symmetry. And on his face, I was looking to check for any rashes, acne, moles, skin trauma, or scars. All I saw was a few moles. The borders were well defined. They were symmetric. There was no discoloration. They were small. No. And they have not been evolving. Next, I'll look at his eyes. So what I'm checking for is that there is no swelling or lesions, that his conjunctiva is moist and pink, and that the sclera is white. I did not see any redness or yellow, and that there is no conjunctival discharge. Next, I will check his nasal. So the color is pink. There is no discharge. It's patent. I didn't see any foreign bodies or deviations of the septum. Next, I will check his ears. So color of both ears is pink. I did not see um, any foreign body, and I did not see any discharge. Next, I'll be checking his mouth and throat. Oral mucosa is pink and moist. The texture is normal. I did not see any postnasal discharge. Throat color is pink, and the tonsils do not look abnormal. I didn't see any redness or any kind of discharge. Next, I'll be checking his neck. So what I'm checking for is symmetry and making sure I don't see any visible pulses or mass or any discoloration, and I did not see any of those. Next, I'm going to palpate his scalp, and what I'm checking for is any balding, masses, or tenderness. Then I'll check his sinuses. So on his scalp, I did not see any balding. I did not feel any masses, and he stated that there was no tenderness. On his sinuses, he said that there was no tenderness on his frontal and maxillary. Next, I will feel his carotid. The intensity is 2 plus, which is expected on both right and left carotid. Next, I'm going to check his jaw. No. Okay. So what I'm checking for as he opened and closed his jaw is if there is any limited range of motion and if he hears any clicking or popping, and he said he does not. Next, I'm going to check his lymph nodes, and I'll start with the cervical lymph nodes, which are on the neck, and I will check it by doing a Z form. I did not feel any nodules. Next, I'm going to check the supraclavicular. So I did not feel any nodules. Next, I'll check his occipital, which are located in the back of the head, submental, which are right under the chin, and submandibular. And then I'll check pre and post auricular, which is in front and behind the ear. Okay, I did not feel any nodules. Next, I'll auscultate his carotid. Both left and right carotids, I did not hear it breathe. Next, I will be doing some tests. I'm going to see pupillary reaction to a pen light. I'm going to be checking for perla. Both left and right pupils are equal, reactive, round to light and accommodation. Next, I'll be checking extraocular eye movement. And next, I'm going to be checking for peripheral vision.
2, 2, 3, 1.
So patient was able to follow my finger, and he was able to get the correct number of fingers for the peripheral vision. Next, I'm going to do the visual acuity test. I have some letters on lines here. The whole
F, D, J, K, B, Z, U, D, E, X, A, R, T. F, D, J, K. F, D, J, K. B, Z, U, D.
Patient was able to read all three lines with both eyes, and then he covered the left eye and then covered the right eye and was able to read the lines. Next will be skin, hair, and nails. I already palpated the scalp, noted that there was no masses, no tenderness. His hair, I already looked. The texture was coarse. There was no balding or dandruff. His face, I already looked. There was no acne or scars, dry skin, bruising. We did note the moles, but there was nothing significant about them. Orbital eyes and eyelids. I'll look at the hair. So both left and right eyelashes, there's normal hair distributions, no lesions or swelling. His neck, I had already checked. There was no discoloration, scars, or palpable masses or pulses. Anterior chest. What I will be checking for is to make sure that it's symmetry. I'll be looking for any redness, rash, dry, scars, mass, mold, or any lesions. So anterior chest is symmetric. There's no rash, striae, scars. There are some moles. There's no discoloration. The borders are defined. They're small. Have they been changing?
No.
There's been no evolving moles or lacerations. Next, I will look at his abdomen. There is hair, but there's no excessive hair. There's no mold, rash, or any scars. Next, I will look at both arms, right and left, as well as elbows and hands. So on bilateral arms, elbow, and hands, I did not see any bruising, any rash, any hives. There were no lacerations. There was a small cut to his index finger, and while I checked all of these, I looked at his fingernails. I did not see any pallor, cyanosis, clubbing. And I checked capillary refill on all 10 fingers, and all capillary refill was less than 3 seconds. Next, I will check his back and shoulders. So, upper back, there is a tattoo, but I did not see any redness, any rash, any scars, or any moles. Next, I will check his lower back and sacrum. Lower back and sacrum. There was nothing significant on the skin, no rash, moles, any cuts. Next, I will check his hips. With his hips, there was nothing significant. There wasn't any rash, redness, scars, striae, any cuts. Next, I will look at both left and right legs and check for any skin issues. So, left and right legs and knees, I did not see any cuts, rash, striae, any lacerations, any moles or masses, or any discoloration, and I also did not note any swelling of either leg. Next, I will look at his ankles, feet, and toenails. So, ankles and feet, I did not note any swelling, any rash, moles, any lacerations or lesions, or redness. With the toenails, I looked, I did not see any pallor, cyanosis, any clubbing or fungus. I did check capillary refill, and all capillary refill was less than 3 seconds. And I also did not note any wounds. So for the last test, it'll be skin turgor. And there is no tinting. So this is the end of the head, eyes, ears, nose, and throat, and skin, hair, and nails assessment. Again, my name is Brandi Reyna. Thank you.